Hey everybody, welcome back to Manic Energy. Today we're joined by Annie Bushey with Holmes Murphy. Looking forward to getting into the exciting topic, one that I know enough to be harmless on, health benefits. I'm Ryan Swar, and this is Manic Energy, a podcast that dives into the fast-moving world of energy, business, and the people powering it all. From bold ideas to real-world innovation, we're talking breakthroughs, market moves, and the community shaping what's next. Whether you're building for the future or just here for the fun, welcome to the chaos. So Annie, maybe start by giving our listeners and viewers a background of who you are.
Yeah, thanks. Thanks, Ryan, for having me. Like Ryan mentioned, Annie Bushey. Like any little girl, always dreamed of being in insurance and employee benefits, which is 100% sarcastic. I actually stumbled into this industry through an internship program. So started my career very young in this industry, worked for a competitor for about 4 years, and then stumbled upon Holmes Murphy, where I am today. And I work closely with employer organizations, helping design competitive employee benefit packages to help them attract and retain their talent while also balancing costs. So very aware of healthcare trend and inflation in today's market and the impacts it's having not only on employers, but employees as well. So happy to be here today to share a little bit more about some of the insights I have and some of the trends in our industry.
Wonderful. I like to think, we work together now for a few years, and
Yep.
I like to think that us connecting was maybe an inflection of luck, timing, and fate. You happened to come into our lives right around the time when we were transitioning back to a private organization as Lake Superior Consulting and had some control again
Yep.
over the decisions that we're making respective to insurance. And I have to say, I've heard of cold calling, but is bundt caking a new thing that you're trying to make a trend? Or tell me about that story.
I didn't know if you guys remembered that or not,
I
because
remember.
when I dropped off it was a mini bundt cake. And when I dropped it off, no one was there besides your receptionist. And Rob wasn't, of course, working on a Friday. So left it, I think, in your fridge, maybe in your break room, and then followed up with an email to Rob. Timing was working in my favor, a little bit of luck too, since you guys had been evaluating. I think Rob told me that I was the 6th firm that you had talked to. But then I think from there, just continue to stay in touch and stay top of mind and bring insights and just different ideas for you guys to consider as you were redefining really your employee benefits program and philosophy at LSC. So yes, timing was certainly working in my favor, but I had to get creative to try and get your guys' attention.
Well, I ate the bundt cake. Did you know that?
No, I didn't know that.
So all yourself?
Oh yeah.
You just ordered it?
We have some people in HR, Rob and Ivy, and I think I was walking by and they're like, "Hey, do you want a bundt cake?" I'm like, "This seems like a trap. Like, am I playing mousetrap right now?" I mean, maybe. Why? And he's like, "Oh, somebody stopped in and dropped it off for us, and we don't want it." I was like, "Well, I'll have a bundt cake." I ate it. I was like, "This is delicious. Who brought this? Who is this person?" And I think, and he's like, "Oh, somebody is just trying to get our business with insurance." And I was like, "Oh, yeah, okay, that never works." But apparently it works. So
apparently
bundt cake,
it does.
apparently
Well,
it does.
in Duluth, you guys don't have. I don't think at the time, at least, you didn't have nothing bundt cakes here. So I knew it was different.
Okay, so that's what it was.
Mm-hmm.
So, is that something you do? You're out trying to get business, or was that kind of just more of an opportunity that you saw?
It was an opportunity. I think that I stopped at 11 or 12 different businesses in Duluth that day. Another one is actually now a client of mine. So
wonderful.
now I have 2 clients in Duluth. But I think, opening doors in any industry is really hard, especially being in a business development role. So I think creativity is, of course, important to start that initial relationship. But then I think more important is the follow-up and not only persistency, but just being a familiar face and then delivering value in conversation. I think that's really key. I still remember a follow-up call I had with Rob following that bundt cake delivery. And I mean, I think we just talked for 30 minutes over the phone, and it was just more of a discovery conversation more than anything, where he could share a little bit about his insights with the former organization, now LSC, what the transition's been like, and any, challenges he was having relative to benefits, and how, I might be able to help him think of things a little bit differently.
So can we back up for a minute and can you tell us what the role of a broker is?
Yeah. So the role of a broker, I would say, has evolved over the last several years. I would say by and large, we act really as an extension of your team as it relates to your health and benefits that you offer your employees. So really serving more in that advisory kind of role, and helping our clients make decisions, but also guiding them strategically on the benefits that they offer their employees, how they want to structure their program, and then, of course, balancing cost is a key component of it as well.
So what types of benefits are you talking about? I mean, we hear benefits, are you working with employers or employees or both?
Yes.
And then on what subjects? Is this like 401k, or is it more just in insurance, like health benefits?
Yeah. So think of kind of your core health and ancillary benefits. So everything from your medical insurance to dental, life, disability, any ad hoc benefits. So, whether that's maybe some concierge like services, caregiving benefits, any sort of voluntary benefits that you offer your employees, really that entire package regarding benefits is really what we consult on. And I would say, depending on the client, we then pull in different layers of expertise internally within Holmes Murphy. So that could be our communications team or compliance or pharmacy, but really kind of supporting that full client experience outside of just the day-to-day support, but also that more strategic support as well.
One of the things I fell in love with consulting is just the different industries and businesses that you get to work with. And I mean, I don't want to summarize. I've just worked for so many different businesses and different industries, from manufacturing to marine shipping to energy, to I don't know, you name it. We probably connected with it at some point. Do you work with a certain type of business, or is it big and small in any industry?
I would say any industry, mostly mid-market employers. So size is a commonality. I would say anywhere from 100 employees up to about 5,000. So well diversified in that mid-market, but really any type of industry. Lots of privately held businesses. Again, kind of finding that common alignment with our ownership structure at Holmes Murphy being employee owned and privately held. But to your point, I mean, yes, I get to learn a lot about a lot of different businesses. And I think, for us to do our job really well as a team, we need to understand your people and your workforce, and really from a benefits standpoint, what they're looking for in terms of a benefit offering. And, demographics is one part of that. But even when you think about field versus office staff, hourly versus salaried employees, really getting creative with the types of benefits you're offering, different segments of your workforce, and really what's contributing to higher levels of retention in those different segments as it relates to your benefits program.
So it's mostly about retention, probably is the end goal.
Right. Yeah. And I mean, attraction too, depending on your growth strategy as an organization. I mean, I always tell my clients, if you have a long tenured employee population that, you have stagnant growth year over year, not looking to do things very differently, that your health plan, your 401k, your compensation are, what your people value, I honestly probably wouldn't change much as it relates to your benefits program. I would focus on balancing costs as it relates to your health insurance. But if you know what's working, continue to do that. If you're an organization that, wants to be more forward thinking, you have, significant growth goals over the next 3 to 5 years, you're looking to kind of redeploy a different type of philosophy as it relates to benefits, then I think we should be considering some different strategies and solutions that really help you attract that type of workforce that has that expectation of their employer that they are more innovative and forward thinking. So I think you can mirror what your business objective is or your growth goals are with the benefits that you offer your employees.
Do you notice a difference in industries? I mean, it sounds more like demographic and employees drive what you would recommend an employer do. But is there a difference in industries as well, or is it pretty similar?
I would say there's a difference. I think employees, to your point, drive a lot of that. I think one commonality across all industries is just the lack of education and understanding there is within benefits, particularly health insurance.
Hmm.
And I would say, as it relates to just communication strategies overall, that's a huge opportunity for employers to really redefine what their approach is to how they communicate benefits. I think people are always surprised when I tell them that, benefits are typically your second to fourth largest business expense behind payroll. So with that, you're investing a large amount of dollars. How are you actually communicating the value to employees? And that, I would say, is probably the greatest opportunity I see within the benefits space.
You must have some pretty crazy stories working with so many different companies, like different industries, different companies over the years. Can you share one of them with us? I'd just love to hear. You got to have something wild in there.
Oh gosh. I feel like my craziest stories have probably come from open enrollment meetings every year. And that could be with, one employee throwing just a curveball question at me around, why is health insurance so much money, or I can't afford this. But in terms of one crazy story, nothing comes to mind. I wish you would have prepped me on this because now I'm on the spot. I think, definitely trying to find common ground with employees during those meetings is really important. And having a partner that can explain things clearly and concisely in those meetings, because it is overwhelming. And at the end of the day, any changes you're making to benefits impacts people and their families. So I try and just be very sensitive to that and humanize it more than I think, any other insurance product out there. Health insurance is so personal.
Mhm.
So if we can figure out different ways to reach people and have a little bit more empathy in those conversations, I think that has served my clients well in the long run. But a lot of those crazy stories come from those questions with disgruntled employees during open enrollment.
It's daunting. I mean, I was involved in setting up our plan, right? I wouldn't say I led it in any way, but I was there, right? And
Hmm.
so probably had early visibility to what we were doing when we made some changes. And then it came to open enrollment, and I had to have my wife help me
Yeah.
because I'm like, wait a second, with that, what is this? Did we talk about this? And I'm like,
Hmm.
I'm wanting to select this box and that box. She's like, don't do that. We
Yep.
don't need that. It's like, well, do we not have that right now? And it's really daunting. So
Yeah.
what would you recommend to individuals? I mean, we've talked a little bit about the
Yep.
company perspective, which is probably applicable certainly to some, but I think applicable to all would be, what we as individuals should be thinking about. I mean, does it change if you're single and in your 20s, or if you're, older with a family and a lot of
Yep.
dependents? There's a lot of different options oftentimes for many employers. Like,
Right.
what would you recommend anybody listening that they should be thinking about?
Yeah. I always try and focus on your total out of pocket costs for the year. So when you think about health insurance and health care costs, you can't necessarily predict any of that, but you do know if you're on any maintenance medications. Um, you do generally know from a deductible standpoint, kind of worst case scenario, if you did reach that out of pocket maximum, could you foot the bill for that? Essentially, that would be a question I would ask and try and understand total liability from the employee side, and then factor in the per paycheck contributions after that. I think, I'm a big proponent of health savings accounts. So paying less per paycheck on a high deductible plan, and then using that health savings account or that HSA as a vehicle for savings, knowing that there are some really good tax advantages there. So I always, if I consult any of my, young friends early in their career on health benefits, I always say a high deductible plan, you get one physical a year, put the rest of your money into an HSA and just see that continue to grow, and invest that over the years. If you're a family and you have more expenses, look at that total out of pocket costs and kind of go from there.
Do you find, appreciate that, really
Mhm.
helpful to hear. I want to get a little bit into ancillary benefits as
Yeah.
well. Do you find that the benefits program, that specifically health and ancillary benefits
Mhm.
around that, sort of sometimes match the culture of the organization? Like, yeah, I think about something that you taught us, and just really, I had never had the opportunity to design a plan before or contribute to designing one. It was like, well, what's important to you as an
Mhm.
owner, as an employer? If you add these programs around wellness, for example,
Mhm.
it costs more in the short term, but you're making a long-term investment, hopefully in the health of the population of employees.
Right.
Can't prevent everything, but that preventative screening,
Mhm.
do you make that free
And
so
you're
that
talking
people
about
have,
even like our wellness program too, like
well,
incentives
I'm talking
or
about ancillary, that
okay.
Yeah.
incentives or anything around it. Like, I
Yeah.
guess my real question is, for those medium-sized businesses, which it
Mhm.
sounds like kind of that middle market's where you
Yeah.
work most. Do you see that there's a matching of the culture that an employee can expect or an individual can expect at an employer
Mhm.
and the way they've established their plans?
Absolutely. Yeah, I think that's definitely twofold, especially when you think about just the type of people that you're looking to attract and retain within your workforce. If you have a lot of employees that kind of fit in that sandwich generation, let's say they have young children and then aging parents, like there are benefits to offer those types of people. We could look at different caregiving concierge programs to factor into your benefit program. So I would say thinking again back to the demographics that you're looking to attract and retain is definitely key, and then just making sure that you're also mindful of the return on investment of these types of
Mhm.
programs. So I'm actually not a proponent of just adding everything and everything. I am very cautious about adding new benefits or recommending that my clients just add a new benefit because it sounds cool and trendy. I think we need to put more pressure on your vendor partners to establish a clear ROI. And that could even be getting creative around how you as an employer are paying for these benefits.
Mhm.
So maybe we look at like a utilization or a case rate. So, if someone enrolls in this benefit, you don't pay a per employee per month fee for that, but you pay a per utilization or per engagement
Mhm.
rate so that you're actually showing, okay, people are utilizing this, I'll pay for it when they do, rather than I'm just going to, pay a flat fee based on how many employees I have. So I think
Sure.
putting more pressure on your vendor partners to establish that ROI is really critical.
And I guess I'm not thinking about it as an owner. I'm thinking about it from an
Okay.
employee
Yep.
perspective, looking at organizations. So let's say I'm looking for a job or a career.
Yep.
How much can you learn about that company by looking at their benefits package? Because I've been asked a lot of times in hiring people, what's the
Hmm.
culture like?
Yeah,
And and I just wonder if there's a way when people are evaluating the organization they're going to, they certainly look and feel the recruiters they talk to,
for
but
sure.
can you learn anything looking at a business by uh, about its culture, about what they're about by the way they've structured their benefits program in your experience? That's really what I was wondering, I guess.
Yeah, yeah, I think you definitely can. I think it's going to help you understand if you're, in an organization or considering joining an organization that is investing in people at the end of the day. But I would look at it even more holistically than that and, thinking about career development opportunities, learning and training programs. There's a lot more there than just the tangible benefits, but I think the benefits offered, are they cost effective for my family? If I'm a, one income household, that's a question I would be asking. If it is a demanding job that I know that I'm signing up for or considering joining this team where I need to work X amount of hours per week, do they give me flexibility? Do they make benefits easy and affordable for my family? Those are questions I would be asking. But I think, yes, to answer your question, it definitely is indicative of the culture that I see within the clients that I work with.
It, it sounds like you don't work as frequently small business, but a lot of the country is made up
Hmm.
of or by small businesses,
Hmm.
right? So a lot of people in that segment. Is there any differences? Or are there any differences with respect to that? So if you're a small business,
Yep.
I think of like a construction company or a podcast studio. Is
Hmm.
there any differences there?
I would say the availability of what you can offer is going to vary. So you might just have a smaller offering of benefits. Same thing with affordability and cost. It is expensive. So a lot of that cost shifting goes to employees, which they might make up for in higher wages. So definitely those are two areas that I see as sort of a difference in small businesses versus mid-size or larger employers.
Going back to something you said earlier about it being on the top of the list. I mean, it
Yeah.
is number 2 beyond payroll for us.
Yeah.
I would hope it comes down at some point, but it feels like it's not going to.
Yeah.
I'm sure there's a lot of policy things that are going on right now as
Yeah.
well. What are some things that we can do to control costs, either as an employee or an employer? Maybe let's answer it from the employer perspective first.
Yeah. Yeah, I think you're right. I hate to be the bearer of bad news, but costs are not going down. And if you look at even the last 20 years, I mean, medical trend has outpaced general CPI for, as long as I can remember. So I think knowing that it's important to take a really active role in managing healthcare costs. And so, one of the first things I would do if I was an employer is understand how I'm funding my health insurance today. So when you think about fully insured, so you pay a flat premium every month for your insurance and, you transfer all that risk to an insurance company, it's typically the most expensive way to purchase insurance over the long term. So as you move across the funding spectrum, there's different opportunities like level funding, captives, self-funding. We've seen ICRAs become, more common in this market as well.
Can you define what that is?
Yeah. So it's an individual coverage health reimbursement arrangement. So think of it as basically saying, we're not going to offer a group health plan anymore. We're going to give all of our employees reimbursable dollars on a pre-tax basis, and they're going to purchase plans on the individual marketplace. So definitely a different philosophy as it relates to offering benefits. But in places like Minnesota, where the individual market is very competitive, it has worked well from a cost savings perspective. And I'll caveat that by saying, there's a lot of differences between the group marketplace and the individual marketplace. Plan designs, of course, being one of them, and the complexity of all these different carriers employees then have to choose from. But, certainly just understanding your funding options, I would say, is the biggest opportunity. And then understanding with that what kind of flexibility you have to manage those large cost claimants on your plan. So I think when you think about like wellness or well-being within your health plan, there's certainly a place for that. And I always like to, focus on preventive care. So how can we, defer people from becoming that high cost claimant in the first place? But when you think about just that top 2% of your healthcare costs is driven by a very small amount of people, that is something that needs to be tightly managed, and a self-funded plan has more flexibility to help you do that.
And what about from an employee perspective? Because it's probably a big cost for most people as well.
Yeah.
One of the biggest things coming out of the check.
It is. So I think there's been an evolution. There's been some new legislation that is, forcing providers to be more transparent with their pricing. So I think we'll continue to see more developments there where, when you go in for an MRI, typically today how health insurance works, you don't know how much that costs. And so having more price certainty before you go to the doctor, we'll continue to see more solutions there. I think most carriers have some sort of, pricing tool that I would encourage all employees to utilize to understand out-of-pocket costs before, seeking care. But I also think there's a huge opportunity with virtual care as well. So encouraging all of us to think about, okay, my kid has, let's say it's strep throat or an ear infection. I know this. I know I need this prescription. I can do a virtual consult. Or, there's different providers that, I've seen employers offer that will actually send a provider to your home. That is a different way of care delivery as well that saves the employees money. So just thinking differently about how you're using care and accessing it, and then factoring in those price transparency tools as well.
What other kinds of trends do you see? on the horizon? Like if you had to predict,
Yeah.
we can get wild too. Like 20 years from now, here's my best guess as to what the world's going to look like. I don't think anybody can do that.
Right.
But I just find it interesting. I'd love to hear. You've been around it for so long.
Yeah. Have you heard of GLP-1s before?
Oh, yeah.
Okay. Yeah. So
Very much so.
I would say that's definitely a trend we're seeing more of. If you're a business owner, you have an HR team and they have not been asked about coverage for GLP-1s, that would shock me. Because just to give you some insight into statistics behind GLP-1s, so about 35% of employers cover GLP-1s for weight loss and type 2 diabetes. The majority of plans only cover GLP-1s for weight loss or for diabetes. So that's important to understand. I think we're going to see a shift where more employers start covering it for weight loss. The effects, I think, of the drug at this point are relatively unknown, especially long-term effects. But when you even think about it from an employer standpoint and how it contributes to attraction and retention within your benefits offering, like that's a very real conversation we're having with our clients as well. I think the biggest question mark at the end of the day is cost too. So right now, the cost of these drugs are expensive. So if you do cover them as an employer, I mean, you're forking over, $1,000 per month for an employee that's covered on one of these medications. So that impacts pharmacy trend, that impacts the entire group overall. So I think it's just being really diligent and understanding some different, programs you could potentially pair with these medications. So whether that's requiring someone to have, be enrolled in a weight management program in order to have GLP-1 coverage for weight loss, definitely seeing more of that. But that is something that's definitely not going away. So a trending topic right now, but we'll continue to hear more of that. Do you have any predictions, Ryan, for the future of healthcare in the next 20 years or employee benefits?
Can you ask me an easier question? I have no idea. I was going to
say that's a hard one.
Yeah, I have no idea. I mean, so my son, let's get real. I guess my son started a GLP-1 recently.
Yeah.
He's a type 1 diabetic, which is immensely different than what people perceive as, or what a type 2 diabetic is. We know that now. But it certainly has made a big impact on, I think, on our quality of lives. And so I see what you mean. And certainly it wasn't, that's not a case of weight loss usage. It's really for his type 1 diabetes, but it's made a big difference in, the amount of insulin he's required and his eating habits certainly as well. So I think you're right. I can see it, changing quite a bit. I don't know. I just, from my perspective, I can only I only try to think about like, what can I control in business and as an individual? And it feels like I have zero control when it comes to health benefits, other than how we design our program for our employees. So I've always appreciated your perspectives and your team's perspectives at Holmes Murphy on, hey, what are your goals? And because your goals can and should drive your plan and how much you spend on it. And, what do you feel you can cover, based on those goals? And that was a really fun conversation because I feel like I have some control there. With respect to what's happening in the future, I just have no idea.
Yeah.
I would say that all I'm doing is planning for it to get worse.
Yeah.
Which is probably a, dismal outlook, but it just feels like, hey, I'm going to plan for the worst and be pleasantly surprised if that's not the case in terms of cost, in terms of availability, options, all the above.
Yeah.
And then I have some people in my life that are very much entrenched in the medical industry, and it's sort of like, my father knows a lot about cars, so I never really had to.
Yeah.
You have other people to rely on to help me through it. So it's not really an area I've thought about much.
Yeah.
So the other side of that, or what we can do to, I guess, get ahead of it a little bit, is talk about being a good healthcare consumer.
Mm-hmm.
Can you talk about that a little bit? What exactly that means and how you educate employers to then educate their employees?
Yeah, I think that's a key part of it. And it's funny when we talk about consumerism in Minnesota, especially. I mean, we were early adopters of what's called a high deductible health plan. So several years ago when we came out, I think they're called consumer directed health plans, so CDHPs at that point. We thought everyone was going to change their ways because they didn't want to pay a high deductible and they were going to think about where they went for care. And that's not necessarily the case. So I would actually put more weight on employers and say it's actually the employer's role to make insurance easier. So rather than just solely relying on employees to be good stewards of where their money goes, I mean, we've now learned that really doesn't work super well. So I think if employers can focus on delivering programs that improve access to care. So the example I gave before was providers coming now in-home or delivering care virtually. I think that ease of use and just having direct access to a provider that's quick and efficient and can get you what you need for those very kind of more acute things that come up within healthcare, that is definitely going to check that box in terms of consumerism, but not putting the sole kind of focus on employees. So not totally answering your question there, but I think, again, I would push employers to think differently about how they're delivering access within their health plan.
Okay. A lot of communication
Yes.
comes from that. What's the best way employers can communicate these benefit options to their employees? 'Cause
Yes.
I know you mentioned having a communications
Yeah.
team.
Yeah. I love this question because I feel passionate about it. So I think it goes back to understanding the people you have employed for you today, what they prefer. So, I work with a transportation company. They have a lot of drivers, long haul truck drivers. They are on the road all the time. They have their mobile device and that's it. And we reach them through texting. And that's how we communicate through them. And that's benefits related. It's non-benefit related as well. But we know that that is the best medium to reach those people. I think if you have a lot of people that are at a desk all day, email is a lot of times the best way to do that. But, we've done everything from town hall meetings to lunch and learn webinars to in-person meetings, one-on-one enrollment meetings, whatever you can do to just continually get in front of it. And then just being more strategic in your communication. So it's not just during open enrollment, but it needs to be if you have an internal marketing team in conjunction with that team and just having a consistent message coming from, the highest levels of leadership within your organization. Again, going back to, we know this is an investment, so let's make sure we're communicating that to our people. And if the goal is consumerism, let's have a directed campaign around that. So again, going back to the goals of your program, we can narrow that in from a communication strategy as well.
Do most employers or do any employers share sort of benchmarking data? And maybe if you could explain what benchmarking is.
Yeah.
And then also, is it okay to share that with employees, and should an employer,
Yeah.
or can employees request this type of information?
I am a big proponent of sharing that with employees. So to go back to your original question, benchmarking essentially is looking at kind of key data points that help you understand as an employer what other employers are offering in terms of course, plan design, but even more broadly from a benefits standpoint, and how they're thinking about benefits. So when you think even back to, LSC's benefits philosophy and kind of where you've evolved and changed over the years, I mean, you guys have always been very rich in your offering of health insurance to dependents. So that's been a key part of your value proposition from a benefits standpoint. And what's influenced that is a lot of the benchmarking data that we've used to evaluate what you offer from a plan design and premiums perspective compared to your industry peers. I think it's not only important to include that benchmarking during open enrollment, but even for your recruiters that are hiring candidates, they understand where your benefits stack up compared to your peers and really sell it. Same with managers. Your managers should be trained in the benefits you offer as an organization, and they should know, at least at a baseline, if your program's competitive and where you're driving the most value from a plan design and premium perspective.
I feel like I have a decent handle on that part of it, but what I don't know is, do we share that Is that transparent? You know, Katie?
I feel like, well, and now because I get a
We're
little
going to have to look at that. We have to
well,
find out.
and I'm a little bit behind the curtain on some of the conversations with HR.
Yeah.
So as an employee, I think there's a little bit of right?
I
Didn't
think
we?
we do. We for sure talk about it at open enrollment.
Yes,
Yeah,
I feel
okay.
like I see a slide where like
Yes,
benchmarking
yep.
information's on there, but I don't, beyond that, more of the education behind what benchmarking is. and-
Right.
Mhm. Hard to do this stuff well.
Yeah, it is. And you have to be really intentional because I think, some employees could hear that and say, wow, LSC just wants to tell me how much money they spend on my, so
yes,
like
it's
Yeah.
a fine line.
it's a
and
fine
balance.
line. And
yes.
I think it's really about the objectives.
Mhm.
Like, yeah, I'm proud of the objectives. Like,
Well, they're genuine.
like
I feel,
taking care of families.
yep.
Making sure that we've got a lot of incentives around wellness, like because we want you here for a long time and healthy, not yeah, we'll deal with this if we have to,
Right.
sort of
Mhm.
perspective.
Do you get much feedback on benefits from any employees at LSC around what you guys offer?
I wouldn't say I do. I'm sure we have people that do.
Yeah.
Nobody's really. I don't think anybody blames me for things. But
Not yet, at least.
it's what you get with really good help and a really great team.
Yeah.
I mean, I'm sure you have the same. I want to call it luck, but circumstance where I feel like we have such a great team that it's been a breath of fresh air to be able to focus on our business in different ways and not have to worry too much about this program. But certainly, I mean, I check in every now and then to see how things are going. But I feel like I was more involved in the sort of the strategic direction. And like I talked to the team, Rob, and I even say, hey, Jeannie, if anything changes, in terms of our strategic direction, let's talk about that. And I don't even think I need to say that. Like,
Yeah,
a pretty good understanding with each other.
for sure.
Which is probably why I'm thinking, are we really sharing this data? Because
Yeah.
I'm focused on our business more than I am on our health plans these days, even though it is our
For sure.
second biggest cost item.
Yeah. No, I know. And like I said, people are always surprised by that. But it goes back to, I think, communicating the investment that you're making into your people and doing it enough to where, you celebrate it too, right? I mean, I think even like your preventive care screenings that you guys do and the incentives you tie there, I mean, why can't that information or the engagement you have in that be shared alongside profit sharing or whatever it is that you do at your annual town hall meeting? And so like rethinking ways that you're really, communicating benefits to your people and who it's coming from. It doesn't always need to come from HR. It could come from your senior managers that are out in the field with employees, talking to them every day. So there's just different ways, I think, and mediums to communicate that historically just haven't been taken advantage of.
Probably my biggest learning in the last few years has just been how many options employers really have. And that applies whether you're a very small business or, 20,000 employees, or, several thousand employees. They have options.
Yeah.
And, I definitely take feedback from people like, hey, have you considered this? And I think we had a question at town hall recently about a GLP-1, as a matter of fact, and whether or not and why we didn't do certain things and what we were going to do in the future. And I thought the team did a great job answering that question because I didn't know. I wasn't certain about what approaches we were taking as an employer. But I think all people should ask. Don't be bashful about asking these questions.
For sure.
To their employer, even though some employers might not be as open to that type of feedback or input.
Totally.
Yeah. What other questions do you have for us? Anything?
Are there any like health insurance myths that I can debunk for you, or anything you've heard that you're like, is this really true?
I'm sure you're aware of some.
Well, that's what I'm like. That's
I
a
feel like
question
I should have
had for
asked that
you.
question to you.
What are the most common misconceptions?
It's weird because it's like I think about health insurance as something I don't want to use. It's like I just want to avoid it. I want to stay away from it. Yeah, open enrollment comes around. It's like, oh, geez, this is really hard to think about this. And I always feel surprised, whether it's at the pharmacy or the doctor when I get a bill. It's like, well, I didn't realize that was going to be that. Sometimes it's every now and then it's a surprise where it's like, oh, that's $1.34. And it's like,
Yeah.
what?
Yeah.
Yeah.
And then sometimes it's a surprise in the complete other direction where it's like, that's $285.
Mhm.
Holy cow, that's a lot. I wasn't
Yeah.
expecting that at all. And sometimes the same prescription at the same facility 4 weeks apart costs significantly different amounts of money in
Yep.
terms of what's out of pocket. And, I'd say that I have to imagine I'm like most people where I just like meet that with frustration, but don't ever dig into who do you call? Like,
What do you
who's
do
gonna
about
who's
it?
gonna listen
It's
anyway?
like getting
Yeah.
gas. It's like it is what it is.
It's gonna
almost.
be
You
what it's
gotta
gonna be.
Totally.
drive your car.
So maybe it's, and I've heard people, well, you should go to this pharmacy because you pay
Yeah.
less at that one than this
Mhm.
one. Is that true? Maybe it's not really a myth, but it's just question.
I would say
Should you do it at a hospital or at
yeah.
a clinic, or is it better to go to, like a Walgreens type place or
Sure.
CVS or
Mhm.
what's the best practice there?
It all depends on the contract that your insurance company has with those providers, or in your case, the pharmacies. So I hate the it depends answer, but it does depend on the contract. So some providers, like for example, Blue Cross, they might have better discounts with the Mayo Clinic than another carrier in the market would. So it really depends on that, and of course that impacts members. But completely understand that frustration, because if there's anything I could fix in healthcare, it would be the price discrimination that exists from one provider to the next.
Is there a map out there that can help?
There
But it
is,
probably
yes.
changes, right? I can't imagine this is a stagnant
Yes.
part of the business.
There is a map out there that exists. We can maybe put it in like the show notes or something,
That'd be great.
that gives you some perspective. And granted, it's not super easy to read, but it does exist and it's out there. But again, offering that price transparency, that was some legislation that came out, I believe it was 2021 or 2022, through what's called machine readable files. And that's really opened the door for providers to have to publish their prices. And I think we'll continue to see that evolve so that consumers can now understand what these machine readable files say. We're also seeing more health plans start to adopt this as part of their offering. So if you've heard of like Surest, or that's a product through United Healthcare, or Coop Health through Blue Cross Blue Shield of Minnesota, what they do is they actually really provide more steerage within their plans to the highest quality, low-cost providers in their network. So giving employees the tools to say, okay, I need to get an MRI. Where do I go? And it pops up every price in your zip code area for MRIs at different providers, as well as the quality. So really focusing on that as more of a steerage opportunity.
Relative to your health benefits, or is that to?
Yes, to your
Okay.
own health benefits. Yeah.
Wow.
So I'm a big proponent of those types of programs. And I think from the employee experience side, that checks that box. But even from the health plan side, my clients have seen, higher savings from, those types of solutions, just given the quality of care they're receiving through those providers versus if they go to a knee surgeon that, does 10 knee surgeries a year versus if they go to TCO. Their care is going to be more efficient. They're going to have lower readmission rates, less complications through one of the higher efficiency, better quality providers. So I would love to see more employers start to take advantage of those types of solutions. And the feedback we've gotten from employees has been excellent.
I feel like that puts a little bit more control into, the consumer or the employee's
Yes.
hands when trying to make decisions in network, out of network,
Mhm.
which clinic, all of it.
Totally. So
Very
would you
cool.
guys say from your perspective as a consumer of healthcare, the biggest like box you wish you could check is that price transparency piece, or is it more so the like care navigation? And that's broad, but where would you see as your biggest pain point as a consumer?
Not having to get a new HSA card every 3 months. It's like, oh, this one isn't good. I've got like 4 HSA
Yeah,
cards.
you're like,
because
how much money is
you
on
can't
here?
stop that M&A activity where it's like we go from this company to that company to that.
That's fair.
I think oftentimes you get blamed as the employer. I have had people give me feedback. Hey, why do we keep switching HSA providers? I just got this card.
Mm.
Yeah.
It's like, hey, we're not.
not.
They were just acquired by, this company, or it's not WEX anymore. It's Health Partners, and now it's
Mhm.
further, and now it's whatever they are. Yeah, that can be really frustrating because it's like then we're at the we've got to pay some bills,
Mhm.
and it's like we don't have these cards anymore. Did we ever even get them? Like I don't know.
Yeah.
I don't know. That's probably my biggest pain point.
What about you, Katie?
I don't know. I'm trying to like I healthcare is it's like I try to avoid going because
Yeah.
it's like I don't know what the bill's gonna be or I just rather not. So I think navigating some of the billing with like the transparency and the in-network
Yep.
out of network and the clinics, having that resource would be huge. I know trying to work through personally some ambulance rides discrepancies. I'm like, why? How does it make sense that this one's in network
Mhm.
complete or out of network completely covered? This one not so much, but
Yep.
you can't quite get someone on the phone to work through it. But
Yep.
that's just trying to educate myself. But calling someone doesn't get me anywhere.
Right.
So,
Yeah.
hmm
Yeah. I would agree. I think the customer service and just getting answers to those kinds of questions, but also wondering what types of questions you should be asking too,
totally.
right? I think
Yep.
that's a key part of it.
Yep. Finding alignment between everyone that I'm talking
Mhm.
to, and yep, knowing what questions.
Yeah.
Yep.
There's a
That
lot there.
maze of the billing.
Yeah.
So,
Yeah, to me, it's like the biggest opportunity is it's in the routine,
Yep.
right? Like you're on this prescription, or
mhm.
you're going in for checkups, things like that. But for me, like I think for many people, when it comes to that rare occurrence where it's an emergency,
Mhm.
then it's just care. We just
Yep.
need
Yeah.
care
Right.
quickly, and who it doesn't matter where, when, or how. We'll figure that part out later.
Mhm.
So I think the real opportunity is probably education around that
Yep.
routine type stuff
Yep.
around where you can stretch your dollars the furthest, because it can be really frustrating and you know saddening at times, to be
Yeah.
honest, where you think about how much you're really spending on some of
Mhm.
this stuff.
Yeah.
Mhm.
Um, certainly with young kids, I think all three of us have young children. It
Yep.
can be really like it's hard to prepare for the worst,
Yeah.
and not many people. It's tough to save for the unknown and the unforeseen. So
Yep.
yeah, I think just like you said, the biggest thing is you said it early, making sure you can afford that worst case scenario
Mhm.
and actually planning for that,
Right.
and being prepared for it, because it happens.
Right.
It's likely to happen to all of us at some point,
Mhm.
unfortunately. And so, yeah, I think the engagement on the front end is really important to me. That having the conversation with a real human about the decisions you're making. It's
Yeah.
so hard for me to sit. I mean, I'm experienced with it, but to still sit there on the computer and during open enrollment and think about, okay, is that the perspective or the lens I'm looking at this
Yeah.
from? Or is it, what's the lowest out of pocket expense I can take right now
Mhm.
and still, have health coverage? I think that's probably how most people look at it.
Mhm.
And actually I've talked to people that are like, you know what, it's health, it's my health. I'm going to go for the most expensive one. You know, I've seen somebody 21 years old, self-proclaimed, super healthy,
Mhm.
no concerns, never had one, and taking the lowest deductible plan, the highest cost plan, and that's their choice, right?
Yeah.
Um, I think for me, it was a lot of learning about the fine line between education
Mhm.
and coaching. And
Mhm.
I'm
Mhm.
sure you run into that a lot, where it's like,
Yeah.
you're not going to tell somebody what to do, but it's about informing
Right.
them of the benefits
Yeah.
and costs associated with different options that are available to them.
Right.
It's just really frustrating and emotional for me when it comes to the healthcare stuff, because
Mhm.
I just don't know. I feel like I'm powerless and um, uneducated, if
Yeah.
I'm being
Yeah.
honest. And I'm sure that's got to be most
Yeah. Oh,
people.
I think it
Feels
it
like a gamble
absolutely
every
is.
open enrollment. I'm like, I
Yeah.
hope this is the right decision
Yeah.
this year.
It's-
Yeah.
Totally.
Yeah,
Totally. Yeah.
No one break an arm.
Yeah,
yeah,
right.
Yeah.
Yeah, I mean, I feel I have more expertise in this industry, and I've felt the same way at times, just navigating healthcare and health insurance, and yeah, the billing side of things, being transferred to coding departments. Like I
Mhm.
feel like I do know the inside,
it,
inside, knowledge to
Yep.
all of this, and I still get frustrated.
it must be really hard to be the person who makes decisions on benefits at Holmes Murphy. That's not a role I would want.
Yeah,
Because you
yeah.
basically got the most educated
Oh yeah.
team members.
Well, and I don't know if I told you,
Educated,
I work on the team that consults on Holmes Murphy's benefits.
Oh, no, I didn't know
yeah,
that.
I don't tell anyone that.
Okay,
So
well, you just
this is
did.
now known to the world.
Yeah, It's out
But
there.
yeah, no, so I
It's gotta
do.
be
And
hard.
it is hard, yeah. But a lot of people I don't think they know that I do, but then I get some emails sometimes saying, why do we work with this vendor? Or like, why is this changing? Or can you help me here? And
Well, if you decide that you want that part
yeah,
edited
I know
out,
we
Yeah.
might
let
have
us
to
know.
cut that.
We might have to cut it.
But I mean, it also, I think, helps me understand too, where we're making investments and what we're recommending for our own internal benefits. And I think that pays, a lot of dividends to my clients, honestly, because I do have knowledge of, where, again, we're making investments in the employee experience as it relates to benefits. Because if I compare Holmes Murphy's benefits to any one of my clients or our competitors in the industry, like we are top tier in that. And a lot of that is a product of just how we view our people and that we're privately held, and just focusing on taking care of, our people and their families. But a lot of the things we're doing is, we're incorporating AI into our benefit offerings and just doing different things that, maybe other employers wouldn't have the knowledge of or wouldn't, take the risk on. But we do that because, that's our job as consultants. And if we're not doing it internally within our own benefits, then what are we doing? So it is a fun client of mine, I will say.
Well, thank you so much for taking the time to come and talk to us today. I really feel like you detangled this a little bit for me. I feel a little bit smarter and more confident on the subject, and I think it's probably difficult for a lot of people. So really appreciate your time
Well, thanks
and
for
helping
having
us
me.
understand it better.
Yeah, I appreciate it. It was fun. I mean, we barely scratched the surface, but if I could shed light into just a few things, I'm happy to. So I love what I do and love the team I work with and the clients I work with. So it's been a pleasure.
Thanks, Annie.
Yeah, thank you.
That's a wrap on this episode of Manic Energy, where the only constant is change. If you're fired up, do us a solid. Follow the show, leave a quick review, or send it to a friend. Got questions, ideas, or a topic you want us to dig into? Drop us a line at the link in the show description. Thanks for riding the current with us. Until next time, stay charged.